Sorry guys, the time snuck up on me again. So we were talking about nebulized epinephrine, and I was telling you how to mix it. So we have 1 milligram of epi 1 to 1,000 in 3 milliliters of normal saline. So we're going to take a glass ampule of epi 1 to 1, just like you would use for treating anaphylaxis. Break off the glass tip. You practice this in class, and you can do this one of two ways. You can either go ahead and draw that into a syringe. So I would have 1 milligram of epi 1 to 1,000 in 1 milliliter of epi 1 to 1,000. Remember to use a filtered needle when you draw out of a glass ampule. And then I could add or withdraw another 2 milliliters of normal saline, either from a saline flush or from a bag of normal saline, or I'm sorry, getting over a little bit of a sinus infection. Or you could already have that 2 milliliters of normal saline in your syringe when you draw up your 1 milliliter / 1 milligram of epi, and you're still going to have 1 milligram of epinephrine 1 to 1,000 concentration in a total of 3 milliliters of solution. Now take that from your syringe, squirt it into your nebulizer, and you'll use it just like you would an albuterol nebulizer. All right, last drug for respiratory emergencies, and that is levalbuterol, also known as Xopenex. This drug used to be fairly popular in the pre-hospital setting, and a few years ago it just kind of went away. It vanished off the face of the earth. It is back. We carry it in Onslow County, and several of the surrounding counties are also using it. In Onslow specifically, we're using it for pediatric patients, though it is not a specifically pediatric drug. We can use this for anyone. So the biggest difference between levalbuterol and albuterol is that levalbuterol doesn't have the chemicals in the medication which elicit a lot of the non-desired effects with the increase in heart rate and jitteriness and anxiety and so on and so forth. Okay, it pretty much is the active ingredient albuterol. There's an S type and an R type. This is the R type is what it's talking about. So the trade name is Xopenex. The generic name is levalbuterol. It too is a beta agonist. Again, it's almost identical. It's kind of a cousin, I guess, to albuterol, but it typically does not cause as many side effects as albuterol does. It works in the same way. So we're not going to go through all of that. We are going to go through the dose. The dose is 1.25 milligrams in 3 milliliters of normal saline. 1.25 milligrams in 3 milliliters of normal saline. And this is a pregnancy class B. Remember that albuterol, albuterol was a class C. So this is a little safer. And the reason that it's a class B and albuterol was a class C is, again, this is the sole R type, meaning that it doesn't have the S associated with it. It doesn't have the bad stuff that albuterol tends to cause. If you have any questions on your respiratory drug cards, please let me know. I hope these videos help a little bit.